Dr. Levine was absolutely instrumental in first learning how to grow T cells. He develops biological therapies. He invented the process to be able to grow and make human T cells to give to patients so that they could now target cancer.
And I think of myself as a scientist engineer. If we think of Carl June as the architect, he has the idea. A lot of times it's a crazy idea.
And Bruce had a lot of creativity to take a basic idea that I might bring up to him and then make it into something that works.
CAR T cells stand for chimeric antigen receptor T cells, are basically a way to take out a human immune cell, a T cell, and genetically change it so it can recognize and target cancer cells and kill them.
Cells grow in the lab for 9 or 10 days. Then we harvest them, freeze them, test them. We can release them for infusion back to the patient.
You know, people were very surprised that we can use a modified HIV virus, a virus that can kill you, but you can turn it into a tool to make CAR T cells that can cure leukemia. The thing is, it worked better than we ever thought it would.
This is the first gene-modified therapy for cancer that has been developed.
We had no idea that we would create a new industry.
I'm the lucky number 21 because I was the 21st patient in the world to get CAR T. So that's like killer T cells in my body to kill the cancer. My dream is to find a cure for cancer and to have every kid in the world that has cancer to be cancer-free. And Dr. Levine and his staff is trying to make that dream come true.
The reason I go to meet the patients is to thank them. They're placing their hope and faith in us.
He was so interested in the patients. He was so interested in who are they, what's happening to them.
He is just such a great guy, and of course his research has just helped so many kids. His team is just really amazing, and they dedicate their lives to that research, and what they do every day is really inspiring to me.
He is not just a scientist. He is every bit a translational researcher, helping patients directly as any of us are in the group.
Bruce has all the world's knowledge on how to make cells at the level of what a pharmaceutical company would do.
He has really contributed in indescribable ways to curing people who have had incurable cancers.
What I'm proud of is having had an impact.
Because we think we're right now just at the beginning of what's a revolution in this kind of cell engineering.
It's not good enough until we cure every patient that gets this therapy, and frankly, until we can cure every cancer. And I think everybody on this team has that same feeling, Bruce, as much as anybody.